Hi, this is Dr. Melhem Restum, and I am at the American Psychological Association conference in sunny San Diego, California. I am the founder and owner of ADAPT. ADAPT is spelled A-D-D-A-P-T, and I'm a child psychologist with a subspecialty in ADD/ADHD. Today I want to talk about the most common question that people ask in our practice, and that is, how would I know if I or my child has ADHD? It's actually a more complicated question than one might imagine, but I'm going to summarize it for us so that you'll have a pretty good idea. First of all, you have to have the primary symptoms of ADHD, and there are two classes of symptoms that we look for. One has to do with problems with paying attention and concentrating. The other has to do with a problem in controlling one's behavior. There's two types of problems with behavior. One has to do with hyperactivity, or maybe the easiest way to think of that is overactivity. The other has to do with impulsivity. The second thing that we have to know is whether or not there are other problems that are compounding or adding to these very symptoms. The most common ones that we find that go along with ADHD are learning problems, but it's not uncommon to find anxiety or depression, and sometimes even Asperger's disorder. The next thing we need to know is whether there's a medical condition that is causing these problems. And that's where we need to work carefully with our primary care physicians or pediatricians so that they can make sure that that is not the case. Next, we need to find out if there are other people in the family who have this type of problem, since we believe that it is genetically passed on, ADHD. And then the next thing is how long a person has had this problem. Since it's a developmental disorder, that means that we believe people are born with ADHD, and that it begins to show itself a little bit later in life for some people, like in first or second grade of school. Unless you're very hyperactive, when parents will notice that toddlers are probably much overly active, impulsive, and difficult to control. Well, that's it for now. I'll talk again about the evaluation process itself and all the different things that we do, including psychological testing. But it was nice to speak to you today from San Diego. We have offices in Sterling Heights and Southfield, Michigan. And talk to you later. Bye-bye.